is definitely what got me started in this. And so when I took my first course, I was about 6 months postpartum with my second son. And I mean, I knew the body, right? I knew the pelvic floor. I wasn't doing a lot of pelvic floor. But I went to that course and I found out that I had pelvic floor dyssynergia. So when I thought I was contracting the muscles, I was bearing down. When I
Mm.
thought I was bearing down, I was contracting. And I had no symptoms, which was awesome. But after that course, I have no doubt that I would have developed probably urinary incontinence, possibly pelvic pain, maybe constipation. And so I just became so passionate that, I mean, so many women have children and a lot of them do have symptoms. And we just kind of hear like, oh yeah, you had kids, it's normal. Like it's just what happens. Or there's a lot of women who don't have symptoms, which is great, but maybe they have some of these things that are going on and we can help. Maybe they don't ever need to have symptoms. I see a lot of women who, have had kids, they do really well. Their body's really good at compensating because their bodies are. And then postpartum, or excuse me, menopause hits, they get a little bit of atrophy. There's a little more things going on, some hormone shifts, and all of a sudden they have all these symptoms. And I fully believe that had they been helped postpartum, they may never have developed those symptoms. So I think it's so important to see a pelvic health provider postpartum. Europe, their like postpartum care is 6 to 12 visits for every mom postpartum.
Wow.
So we are behind. But I mean, I am passionate about postpartum. That's kind of like where I live and love, but it's not just for women who have had kids either. I mean, I see a lot of women who've never had children who have these symptoms. I see a lot of men who have symptoms, and they develop for a variety of reasons. But I think it's just so important, just like every other muscle in our body, to keep functioning well. I think urinary incontinence is one of the top reasons that people get admitted to nursing homes. And so
Mm.
I think there's just so many things that we can do earlier to help prevent some of those things from even happening.
That's great. Yes. You said a lot of really important things there. And I think one, and this was a question I had in my brain, and I've seen clinically too, like you don't necessarily have to have a baby in order to have issues, right? Because I've had women in my practice where they've never had children, but they have pelvic floor issues going on.
Absolutely.
So, yeah, I think that's really important thing, and that as far as trajectory, like it's great, if we are getting that care postpartum, but let's say we don't, right?